to do it that way.
Hi, everybody. This is Melissa Hawkins. It's 7 o'clock, so we're going to go ahead and get started. There's maybe some others that join us, but thank you so much for spending your evening or part of your evening together with us tonight to learn a bit more about the Public Health Scholars Program. I'm joined by Kativa Parker, who's the Assistant Director of Financial Aid, and Melanie Delgado, who's a second-year Public Health Scholar, and we're going to go through some of the programmatic features of our program and then make sure to have enough time that you all can answer any questions and that you can ask questions to both Kativa and Melanie and myself. So I'm going to just ask that everybody mutes their line if they're calling in, especially just so that we can all not be distracted by background noises. And I'm going to put the video on here for me and Melanie so that we can introduce ourselves to you all. So I'm Melissa Hawkins. I'm the director of the Public Health Scholars Program. I'm really looking forward to getting to know each of you and answering any questions that you have. And let me let Melanie introduce herself. She's a second year Public Health Scholar. She's also pre-med. For any of you that are pre-med, she can answer those questions, and I'll let Melanie introduce herself.
Hi, everyone. So yes, I'm a public health scholar, and I'm also, if you guys have any single questions, I'm in my second year of the three-year program. It's really exciting to be knowing that I'll be graduating in 1 year. So feel free to ask any questions because I will be in or you guys will be in my shoes soon. So feel free.
Okay, so we are going to turn off the video section. I'm going to go through these slides. If you have any trouble hearing me or seeing any of the slides, please just type in to the chat on the right-hand side of your screen, and we'll be able to answer any questions or hopefully help you out. This first slide is my information, my email, and my office line. I am available to answer any questions that you have that you think of or that you're considering as you're making your decisions, and I'm always available. And I think I'm speaking for Kativa and Melanie as well, that they're happy to be contacted after we finish the webinar as well. So what we're going to be talking about tonight is the specifics of the Public Health Scholars Program at American University, but I'm also happy to talk about general questions about AU or the culture of our campus, DC and living in DC, the weather that we have in DC, any of those general questions as well. But let's start off talking about the specifics of the Public Health Scholars Program since it's a unique program. So this first slide is of our public health scholars. They did this word cloud when we asked, what is public health? And this is one of the first questions that I get from parents usually and from some students, like what exactly is public health? What will my child be studying? And so these are some of the key words that we think of when we think of public health, but I like to define public health as it's multidisciplinary. So we draw from the social sciences as well as from biology and statistics. Our primary tools that we use to understand and measure health are epidemiology and biostatistics, but we're really informed from a multidisciplinary perspective in understanding how to prevent disease and how to promote health and wellness. So when people ask me the difference between public health and medicine, my answer is medicine treats the individual when they're ill, when they're sick. Public health tries to prevent disease at the population or community level and understand how diseases progress. So medicine treats the individual. Public health, we focus on prevention, and we focus on prevention at the community level. But one of the, yes, please.
Sorry, I don't mean to interrupt, but I can't see any of the screen.
Can anybody see the screen?
No.
So, my screen? Better?
I still don't see anything.
Okay.
It's like a gray screen with admitted AU public health scholars in a white box, or at least on
Okay.
mine.
Okay. Okay.
There we go.
Yay. Okay. Let's back up. Goodness. Okay. Um, hold on. Here we go. Okay. So this was the first slide. So that has my contact information. Sorry about that. That has, and thanks for letting me know. Feel free to interrupt and ask questions as we're going along, and we'll also have plenty of time at the end, hopefully. So this is my contact information and Kativa's and Melanie's. Kativa, are you on the line? Kativa's calling in.
Yes, can you hear me?
Okay, great. Can everybody hear Kativa? Do you want to just introduce yourself briefly, Kativa, and then we'll just keep going and then have the opportunity to ask you questions a little bit later?
Sure. Well, good evening, everyone. My name is Kativa Parker. I'm Assistant Director in the Financial Aid Office. My contact information is there on the slide. So any questions that we don't have a chance to cover this evening, please feel free to send me an email, okay?
Okay. All right, so the next slide, this is the what is public health slide that our public health scholars this fall answered the question. So I'm going to move on to so now can everybody see the screen, the whole screen? Okay. The 3-year public health scholars. So these are the features of the program that make it unique and that I want to talk about this evening. So it's an interdisciplinary program, which means that we have a BA track and a BS track, and both of those degree tracks draw from courses within our department, but also outside of our department. So students take classes in philosophy for their bioethics, biology is a core requirement, in biostatistics, and then electives that are options in a variety of different disciplines. And at AU, we also allow students to take courses across colleges. So we are housed in the College of Arts and Sciences. Our department is, but students are allowed and encouraged to take classes as part of the degree program, as part of their electives, or just out of interest across schools at the university. So that would be the School of Communication, perhaps, or the School of International Service, or the School of Public Affairs. So we're truly an interdisciplinary program, and that's a real strength of public health and our program in particular. The BA, as many of you probably know, the bachelor's or undergraduate degree in public health is relatively new at AU, but in fact, it's very new nationally as well, but it's growing in popularity very quickly. So when I went to school, we didn't have the option of an undergraduate degree in public health. I went to school at Emory University in Atlanta. So I was fortunate that the CDC was right up the street. I didn't even know what public health was, but I worked at the CDC as an undergraduate all 4 years, and that's how I learned and discovered public health. And that's changing now as this generation is being exposed to public health at an undergraduate level. And so what distinguishes the undergraduate degree in public health versus the master's degree is really the breadth of courses that we offer across the curriculum. And so our program at AU has an interdisciplinary focus. And then once you get to the master's level, you're going to be going deeper and having more of a focus. So within our major, we really encourage curiosity and discovery of new interests within public health that you may not have been aware of when you first became interested in public health. So the program at AU I mentioned is young. This is our 5th year offering the degree, an undergraduate degree, and we grew out of biology. So our first public health program was housed in biology, and it quickly became very popular. And then we were able to offer the major in both the BA and the BS. And so this was a little bit unique as well, because this was very much student driven and student initiated, and we were responding to students that were interested in pursuing this degree. So we have quickly become the most popular major in the College of Arts and Sciences, and that is, I think, true across the schools that are offering public health degrees as well. So I think that that's a combination of the interdisciplinary focus, as well as the emphasis that we place on improving health and making a difference, and trying to make the world healthier. So that's really, I think, appealing to students as they're pursuing their undergraduate degrees. So the 3-year Public Health Scholars Program, as you are probably aware, the first year, all of the scholars live together in a living learning community alongside a program associate or a PA. So the living learning community is Letts Hall. For those of you that have visited campus or will be coming to visit, it's what I consider one of the most beautiful buildings on campus, where the scholars are housed up on the 5th and 6th floor. From the student lounge and from the rooms on a clear day, you can see all the way to the Capitol and to the Washington Monument, and it's really spectacular views. So I like to hold my office hours in Letts Hall for a change of scenery for myself, but also just to be able to get to know the students and really engage with them in a less formal way. And then the program assistant, the PA, is an upperclassman, an upper class scholar, so a 3rd-year scholar who lives with the students the first year, and is really a resource, part mentor, part friend, part advisor, someone that you can ask about coursework, who can help assist as you're trying to plan your schedule, and just help with the transition from to college. And so that our PA is a really strong component of our community building within our program. And I also want to mention that the public health scholars all live together in a living learning community, but there are 3 other 3-year programs that are offered by AU. So our public health program is one 3-year scholars program. There's also a global scholars program that's offered out of the School of International Studies, or SIS. And then we also have a PPL, which is Politics, Policy, and Law 3-year program that's offered from the School of Public Affairs. So all of the 3-year program scholars are living together in Letts Hall that first year. So it's really a community of scholars, and that living learning environment really fosters engagement and discussion across disciplines. So that's, I think, a real strength of our program as well. Flexibility. Students come in with varied interests. Sometimes those interests change. Many students come in with advanced AP credits. And I work very closely with our students to just really help design and plan a program of study that meets their needs and their changing needs. And that's in conjunction with our program assistant as well. But we really work hard to make sure that the program meets your interests and your needs. Service learning. So we have the opportunity to be located in Washington, D.C., which which gives us the opportunity to really see and practice public health. So the service learning component of the program is that we have what we learn in the classroom, in particular in Introduction to Public Health. All of the public health scholars will be in the class together. So it's only for the scholars, and I teach that course. And so that's the first first semester or the first year. We're all in Introduction to Public Health together. And then there's a service learning add-on 1-credit component where the students participate in service learning at different organizations in DC, and they do that together as a group and in small groups. So it's a little bit like the internship, but instead of doing when you're going to be doing your internship a little bit later in your program of study, and you're going to be doing it individually at an organization that you identify that matches your needs. This is as a group that you'll be going out together, and you'll be rotating to 2 different organizations. So what we're learning and discussing and reading about in the Introduction to Public Health in our course, you'll then go out and then participate and practice and be engaged in public health work and learn how public health organizations, local organizations here in DC are practicing public health. Then there's the study abroad component, which is a requirement of the program. We have 4 options that have public health curriculums that are very nicely matched with our curriculum, and we work very closely with the schools abroad to make sure that the emphasis is on public health. There are 4 study abroad options. We added Madrid just this year. So there's Madrid, Spain, London, England, Manipal, India, and Nairobi, Kenya. And so those options we start talking about and thinking about in the first year, and hearing from students who have returned to share their experiences and help students as they're navigating and thinking about where they'd like to study abroad. And we'll talk more about the study abroad a little bit later. And then internships, this too is a requirement of the degree, and we offer, we have so many opportunities and so many places that our students can intern, and our relationships are deep with many organizations. And so we have a long history, and we leverage those partnerships to help our students to find, to select, to be able to work in an organization that they're interested in. And of course, we can place students at in national organizations, like we have NIH right down the street, to global organizations, to local direct service organizations that are providing services here for residents in DC. Or if students are more interested in policy or think tanks, there are just so many different opportunities for internships. So we work closely with our students to make sure it's a good fit. And then again, opportunity that really could be, you know, woven throughout all of the features of the program. We're really ideally located to be able to learn about public health and practice public health, and we just take full advantage of the opportunity of being located in Washington, D.C. Okay, are there any questions before I move on? Okay, you can type them in or chat in, whichever way works. So the academic track for the Scholars Program, we offer a BA and we offer a BS. Many of our students do come in interested in pre-med. So the pre-medical track is in biology. We have a close relationship with biology since we grew out of biology, and so we work closely with the pre-med advisor to make sure that all the requirements for the pre-med track are met, in addition to the BA and the BS, if that's an interest. Our students can be double majors, or they can minor in other subjects. You know, this really is an individual case-by-case basis of what the credit requirements are for the other degree programs and how many credits the students are coming in with. But we really can make many interests work for our students. The combined bachelor's and master's degree. So this is a program that AU offers. So AU offers a combined bachelor's and master's across the departments. So for our students, for the scholars, they would be able to graduate in 4 years with the master's degree. And this is possible by sharing some of the requirements that are that qualify for both the bachelor's degree and for the master's degree. So what we would do is when the student is at 75 credits, when they've taken 75 credits already and have expressed an interest and are interested in pursuing this and have a 3.0 GPA, then we can talk about the possibility of pursuing a combined master's degree, which would be completed in the 4th year. So in our department, we offer an MS in health promotion. We don't offer a Master of Public Health, a master's degree in public health, an MPH yet, although that is on the list. We're in the process of going through accreditation right now, so we are proud to be, we will be one of the first standalone undergraduate programs to receive accreditation. So that's really exciting. And so an MPH is on the list, but our Masters of Health Promotion has a long history, longer than our public health degree. That was started in the 80s. So it's quite feasible to do the master's in health promotion alongside with our undergraduate degree in public health. And so we've mapped out those courses for students to be able, that are interested in doing that. Also with biostats, since so many of our core requirements are in the biostats department, and our students have an interest in biostats as it's one of the primary tools that we use in public health. We also have mapped out how a biostats would be a really seamless transition for students that are interested in pursuing a master's in biostats in their 4th year. It's possible to have this master's program across any other department in at the university, but we haven't mapped those out because that's really going to be more dependent on that individual student. So we did the health promotion and the biostats because those are the ones that are most popular and most typical for our students to be interested in. But I could work with you to see the feasibility of doing it across really any department that you might be interested in. Okay, so here are some pictures of our students and previous students working in service learning opportunities as part of the Public Health Scholars Lab. So again, this is the 1 credit add-on that the scholars, and this is only available for the scholars, that they participate in that first year in the fall, in addition to the Introduction to Public Health course. And so Iona Senior Services, we try to cover organizations across the lifespan. So we're examining and participating in health programs and programs that are aimed at reducing diseases and health disparities across the lifespan. So we have a program that's focused on seniors as well as children, and then we have high school students, and then we have a program that works with the homeless here in Washington, D.C. These are some pictures of our study abroad program. So as I mentioned, students can study in Madrid, India, Kenya, or London. Some of the programs you also have the opportunity to pursue your internship while you're there. That's in Nairobi and in Madrid. While studying, you would also be able to engage in your internship. India has more of a focus on independent research, and so students are paired with a faculty mentor while they're in India and can undertake an independent research project. I just returned from Nairobi myself. I went to visit our program over AU spring break just a few weeks ago, and so I had the opportunity to meet our faculty, to see where the students live, to visit the internship sites, and really just learn so much about that program, which is just really fantastic. So happy to answer any questions about that. And Melanie also just returned from studying abroad in Kenya. Okay. These are just some of our internship sites. If you go to our website, you may have already explored the many places that our students have interned, and that list is growing, and that by no means is exclusive or restricted. So if you find an organization that's doing work that's interesting to you, we can help to facilitate that. So this is just a very, very small example of some of the organizations that are here in Washington, D.C., many of them headquartered here in Washington, D.C., that our students have worked, and that you can hear from the student perspective as well about what that internship experience was like, and how it might be a fit for your interests. Okay. We really emphasize career development and career skills for the next steps after you graduate from the Scholars Program. So we have monthly cohort meetings. We have one tonight, actually, right after this. We meet monthly. We have dinner together. It's an informal way to have discussions, to bring in guest speakers. Tonight we have Paula Warwick from the Merit Awards Office, who's going to be coming and speaking about merit opportunities and fellowship opportunities after graduation that students could be thinking about now in terms of pursuing those. And so she's going to talk about how to navigate that path. We do professional development sessions to help students as they're thinking about polishing their resume and interviews as they get further along in the program in their second and third year. Our network, our alumni network is growing and very strong, and our alumni are always thrilled to come back or to engage with our students and just talk about their own experiences in the program and also what they're doing now. And so we're really proud of how strong our alumni network is. And then, of course, you know, the Scholars Program has the benefit of being a really small community where I work very closely with our students to help guide them through all the academic aspects of the program. And then we have an academic advisor also in the College of Arts and Sciences who helps with scheduling. And then, of course, the PA who's available for advising and counseling from the student perspective as well. So I think one of the ways that we, try to support our students is really for a strong, providing a lot of strong resources and engaging with our students in fun as well. We do cohort activities that are just doing fun things throughout DC, and especially in the summer when there aren't many other students except for three-year scholars on campus, of taking advantage of what the city has to offer in terms of fun during the summer as well. Okay. This is coming to the end of my slides, so I want to make sure to have the opportunity to answer all of your questions. Some of you I've met already. Some of you we will be meeting in some of these upcoming campus-sponsored events. I just wanted to put these on your radar in case you're thinking about coming. Of course, you could come to visit campus at any time. Just let me know, and I'll be happy to connect you with a student who could help give you a tour or show you around, and I would look forward to meeting you then as well. So this is a picture from one of our cohort activities just this past winter, where we did a painting, one of those what do you call it?
It was like a canvas painting.
Yeah, painting. So we picked a scene of Washington, D.C. There's a wide variety of skills there, but that's intended to be the Washington Monument and the Capitol, and so that was one of our fun cohort events. So let me turn it over to you to ask any questions that you may have. Or Kativa, do you want to just give an overview of the financial aid questions that you've been getting?
Sure.
Okay.
Well, hello, everyone. Just to kind of touch on the financial aid piece a little bit. One of the major questions that I tend to get is about how the financial aid works in the summer. You all have probably received a award letter with your admissions packet, which includes fall and spring with no mention of summer whatsoever. And that's because summer is the header to our academic year. So summer 2018 is going to be on the next award letter that you receive or that your student receives. Students in the 3-year programs are the only undergraduates on campus who can use institutional financial aid in the summer. So if you have an AU grant or a merit award, a dean scholarship, all of that, including any loans you've been offered or the student's been offered, all of that can apply in the summer as well. So the thing about the summer is the financial aid is prorated based on the credits that the student enrolls in. So if the student is half-time, then they can expect to receive the same financial aid award that they would receive, or excuse me, if they're full-time, they can expect to receive the same financial aid award that they would in a fall or a spring semester. One thing to note, so with the combined BA/MA program, the financial aid that you have on your award letter right now is only good for the undergraduate portion of that program. So once the students go on to the master's piece, they then have to apply for financial aid as a graduate student, and that's a completely different process. So the AU grant, the Dean Scholarship, any merit awards that you've been offered don't apply to the graduate portion, the MA portion of that combined degree program. We also, in financial aid, take into consideration the costs of studying abroad. So that's always factored into the cost of attendance, regardless of the program that the student chooses. Any of the 4 are included in the cost of attendance for that second fall semester. Let's see. What else? What other questions do I get? The cost of the program as a whole. With the summers, the tuition is charged per credit. So if you imagine a regular fall semester, a regular spring semester, the cost of the summer can be about the same, on par with what you pay or what you'd have to pay in the fall or spring. It can change a little if the student's enrollment changes, if they're doing an abroad program, if they're taking some online courses. Some of that can change the total cost of the program, but the financial aid stays the same. As long as the student maintains eligibility requirements, GPA, number of credits. I see a question there, are Parent Plus loans available? Absolutely. You can definitely apply for a Parent Plus loan online with the Department of Education. And the website is www.studentloans.gov. You can apply for a Plus loan any semester, fall, spring, summer included. We also have payment plans through the university. So there are a few payment options available if the financial aid that was offered does not meet the total cost of attendance. We have another question. Would the 2018 summer be the only summer incoming freshmen would need to have? That might be more of a program question. So I don't know if Dr. Hawkins, if you want to take that one.
I'm sorry?
But the financial aid applies to both summers.
That's right.
So whether it's the first summer, second summer, you can still get financial aid for both summers. So we include up to 8 semesters. 4-year students get up to 8 semesters of financial aid, and 3-year students get up to 8 semesters of financial aid as well, because we do count the 2 summers as semesters and eligibility for any institutional aid that you have.
That's right. And that goes for merit awards that are coming from AU as well. So basically think of those 2 summers sessions as the 2 sessions that you would have in the 4th year. So that equals the 8 semesters that are covered with financial aid and merit aid. And the summer really also just depends on, again, how many credits you're coming in with and which degree track you're pursuing, and if you also have another major or minor. So some of our students are taking a full load in the summer. Some of our students really don't need to take many classes, if any. And so we work with you if you need to be here for one of the sessions or not. If you would like to go home, that's fine. If you want to pursue having employment here or doing your internship in the summer, that's another option as well. So it really just depends on what you come in with and what you're interested in leaving with.
I also know that a lot of students intern over the summer or would like to volunteer full time. So what I find myself doing and other students find themselves doing too is taking courses online. So there's a lot of courses offered online that go towards our major.
And Melanie is working at NIH, and so she works full-time in the summer at NIH and is pre-med and is taking the requirements for the public health degree. So we can make it all work.
Yeah, a lot of the courses actually are offered at different times. So if you, because I intern full time, I also take evening classes. So from like 5:30 to 8 o'clock. So there's like a variety, and AU is really flexible in general. And Andrea Malamasura, who will be your advisor, is really there right with you, trying to figure out what's best for you with all the interests that you have or want to pursue.
Yes, Andrea is the academic advisor for all the public health majors and psychology and anthropology majors. So she is the scheduling master and guru. So she knows when classes are offered and when they're not and how to make it all fit to work. So I'm just going through these questions to make sure I answer everybody's questions. We can see the screen. See, I didn't see these, but now I see these. Okay, so the timeline for expecting to have the MPH offered. Oh, I wish I could answer that question. I mean, there's so many, there's so many competing priorities and interests. I think it's at the top of our priority list, but it takes time to build a program. But there's definitely support, administrative support from the provost and from the top. You may know we have a new president coming in that we're very excited about. So, and she's experienced in public health herself. So we're looking forward to a strong relationship with her and her supporting our program a lot. So I think anything's possible, but I'd hate to, overpromise when I can't speak for sure. So how many freshmen will be in the Public Health Scholars Program? So we'd like to have about 15. This year there are 13 students in the Scholars Program. I think, about 15 is where we like to be. The other 3-year programs have about the same, maybe 15 to 20. We like to keep it small so that we can really build our community. Would the 2008, Hannah's question, would the 2018 summer be the only summer incoming freshmen would need to have summer classes? I think we answered that question. Okay. How do you accept your position into the program? That's a great question, Katie. So everybody nationally, right? It's May 1st is the big decision day to choose where it is that you would like to be staying for the next 3 years. So when you submit your acceptance and submit your deposit, then that means you are you're in the Public Health Scholars Program, and we would welcome you. The information about the overnight stays. So we had an overnight, and I met some of you there last week on April 3rd and 4th. There's another overnight coming up next week on the 17th. I would just ask if you're going to do that. Just shoot me an email and let me know, because I want to make sure that we will be pairing you with a current student. Many of our scholars, our freshman scholars, have indicated that they're available and interested and really looking forward to meeting you. So I just want to make sure that everybody's paired. So the information about the overnight stays and the schedule and all of that comes from our Office of Enrollment, who is Tyler Atkins or Don Mike Mendoza. I'm happy to give you their contact information if you'd like more specifics about the schedule, but I don't see that information. But I will be speaking at the overview. So there's a College and Sciences overview in the afternoon at 3 o'clock or 2:30 to 3:30, and I'll be speaking at that and have a chance to meet you then. And looking forward to that. This is for you, Melanie.
For Laura, thank you for asking. So yes, definitely coming in as a freshman, I would have to say the volunteering aspect of the program I enjoyed greatly, just because coming in as a freshman, I was really nervous and really know everyone in the program. And I think this opportunity where we took the Intro to Public Health together as a class really united us. And this idea where we had to also do this volunteer aspect once a week. So we would get into groups and just like getting to know each other and just applying what we learned from class to these volunteering activities was something that I enjoyed a lot. So that's definitely something to look forward to if you get part of the program.
So one other thing, I didn't get mention my background very much. So I went to Emory undergrad. My major was in anthropology, but like I said, I worked at the CDC, and then I went to grad school at Hopkins in Baltimore, and I studied epidemiology with a focus on maternal and child health, and then I stayed on at Hopkins for faculty for many years. But my family lives here in DC, so I was thrilled to be able to accept the position on faculty here at AU. I've been watching their public health program grow, and so I joined the faculty 2 years ago, and so I live just down the street, and so it's very convenient that we can often have meetings or gatherings at my house, and that just makes it a bit more informal and a great way for us to all get to know each other. And so in a couple of weeks, our graduating scholars, we're going to host a party for them at my house that Melanie is helping to plan with some of the other scholars on the party planning committee. So that's another way that we really try to encourage our community as well. How many elective choices are open? This is how many elective choices are open to you, and what are the options per semester? Okay, that's a great question. So we have a list of electives that are divided into concentration areas. And so those concentration areas are health policy, global health, research,
health promotion,
methods, and social and behavioral sciences. So we ask that you take electives across those focus areas and then pursue one in a little bit more depth. We have a list of courses that meet those requirements, but that list is evolving as new faculty and other departments offer new courses. So every semester we go through and see the courses that are being offered and see what would meet our requirements as an elective course. And if you see a course or you find a course that you think would meet those requirements, we're happy to consider that as well.
To Josie, so I'm actually going to be 19 when I graduate from American University, which is crazy to think about because usually students who apply to go to medical school are usually around 24, 25, or 26. So my plans after graduation is continue to intern at the National Institute of Health. I'm interested in infectious diseases, so I'm going to be hoping to do more research, hopefully get published, and then from there applying to go to med school probably in a year or so. But yeah, I think that this program is wonderful just because for individuals who do want to pursue greater education in health, they will be graduating at a very young age. So you have a lot of time to also do internships and other volunteering aspects if you're interested in that before going into further education.
Okay, Katie's question is which concentrations align to the BS and which align to the BA? So it's the same concentration areas, and it's really up to you which courses you'd like to pursue to complement your interests. The BS itself has a little bit more has more courses, more science courses. So there are 9 additional credits for the BS than for the BA. There's a lot of similarities, but the differences are going to be in infectious diseases and the sciences for the BS. Okay, I want to make sure I didn't miss any questions. Favorite classes, Mel?
Favorite classes, I would definitely say epidemiology was one of my favorite classes. As Dr. Hawkins mentioned before, I interned in Kenya, which was an amazing experience. And I don't even know if I would even have chosen Kenya if it wasn't for the program who offered that specific spot for the public health program. So I took epidemiology, community health, culture and history of Kenya. I took the language of Swahili. So all these programs revolve around public health, obviously. And I just thought learning it from a whole different culture and perspective was something that was definitely a highlight of the 3-year program. I know a lot of students come back with so many stories to tell and also something to write about in your scholarships or even like graduate school essays. It's something that really impacts your life. So that's something that I'm definitely thankful about for the program.
And, with the study abroad programs, the scholars will be selecting one of those 4 sites, but then there are also other students from AU and other students that they'll be participating in the program with and engaging in the program as well. So it opens it up to new friends. There was a question about the housing. I just want to get up to that. So the question about, I think it was, is housing guaranteed? So all freshmen are required to live on campus the first year, and you have guaranteed housing in Letts Hall as a scholar. After spring semester of freshman year, you're not required, but their housing is available and an option if you choose to stay on campus. Obviously, the options for summer housing are much wider, so you have more options about where you'd like to stay on campus if you want to stay on campus in the summer. Students also can live off campus in groups and apartments or brownstones or area neighborhoods right around the university. So if you're interested in being on campus, there are housing that's available, but it's not required except for first year.
I also know I've talked to a lot of freshmen and they've told me, because the cohort is such a tight-knit community, a lot of them are actually living together for the next semester and they're getting an apartment together. So this program really makes you know everyone and you have obviously similar interests. So that's something that you don't really have to worry about because a lot of you would want to either interning or be taking classes in the summer. So you end up finding an apartment together. I know also I'm currently an RA for freshmen. So if you're worried about having to pay for sophomore, junior year for staying on campus, the RA program is another program where you're the one who's responsible for all the freshmen and they're paying you for living and everything. So that's something to consider in the future.
Yeah, so as a RA, you
or a PA.
Yeah, or a PA, right.
Mm-hmm.
Our PA, our upperclassman that lives with the freshmen, or if you're an RA in another dorm, you're compensated your housing costs for providing support and assisting the students on your hall. Okay, so there are some questions about what happens after graduation and where do our students go. Those are great questions. So the short answer is our students have a variety of interests, and so they go in a variety of directions. There are the pre-med students who are applying to med school. Maybe they're working in a clinical position or in a lab as they're applying to med school. Our students, last year we had 2 students who went to the Peace Corps. So they pursued an interest in global health through Peace Corps opportunities. 2 of our students went on to graduate school in public health. One of our students who graduated last year is going to a law school and doing a joint JD and MPH program. So we have graduate school, we have med school. Some of our students parlay their internship or experience that they had with organizations here into full-time positions. That is a benefit of establishing and building those relationships while you're working here. Work experience. Some of our students go into nonprofit work. One of our students went into a think tank. What am I missing? Graduate school,
You covered most of it.
Peace Corps. Yeah. Does AU have a community band?
Yes, we do have a community band, I want to say.
I know we have.
There's a
I
like
know
a fraternity for both females and males, and it's like a music fraternity.
I know we have a orchestra.
Mhm.
I know we have singing groups, a community band.
Mhm.
We probably do, but if we don't, you could start
We can
that.
start it, yeah.
Our students are very engaged and very active. If there's not a club that they have here that they want, they start it. Our Public Health Association is a student-led organization and club that's very strong, very active too. So last week was National Public Health Awareness Week, National Public Health Week, and so our students put on a health policy panel and invited notable speakers in the field to talk about what's happening with the Affordable Care Act and what the implications are. They had a stress release activity. What else did they do for public health week?
They did a lot. I can't really think of any right now, but I know they had different activities that they offer. As for clubs, if anyone is interested in dancing, obviously gym workouts, AU offers a variety of clubs, so they really have everything for every student. And like Dr. Hawkins said, if we don't have something that you are not really interested, or you're interested in but we don't really have it, you can always start it as well.
That reminds me that the Metro, so our Metro system, the Metro train and the Metro buses are included with tuition. So that's an unlimited pass for students to use, 24/7, spring, fall, and summer. So that is really a great way to just, be
You're saving up money.
yeah, it's just feasible too and realistic for you to be able to both explore the city and also get to your internships or other opportunities that you might be engaged in.
Very helpful. I guess what's challenging about my course load would just be, I know a lot of students are double majoring or majoring in public health and then double minoring. So I guess closer you are towards graduation, obviously a lot of your courses are more specific to what your focus is for your education. So just, I guess, balancing everything could be a little hard, but knowing that you have your scholars and your PA there for you. A lot of us have study hours together. And like Dr. Hawkins said, that a lot of us meet up for either in the library or the Sky Lounge on the same floor that freshman year when you live together, you find yourself having the same assignments and essays to write. So it's very helpful that you're living with one another because you really do get together and do homework and discuss and some things that people find challenging during certain
So I'll just add, needless to say, the scholars tend to be very motivated, engaged, and a committed group of students, and they're interested in a variety of academic and also extracurricular, clubs and activities. I spend a fair amount of my time saying, slow down. You can do it. You don't have to do it all at once. There are many different ways to pursue interests and trying to find that balance. But our students tend to be very interested and very, very engaged. Do students interact with students from other programs? So your cohort, you're going to be building your relationships with your cohort the first year in the living learning community, and that's really supported through being with other 3-year students who are on the same track that you are and just in the same mindset that you are. But then that's then you are living with other students in classes with other students. And so, from my perspective, there's a lot of integration with students between programs and across the programs. But Melanie?
Right. I also know that coming in, AU has an option for like roommates. You can choose certain roommates. So a lot of people from last year, actually, their roommate was a GLOSCO, so like a global scholar or a PPL scholar. So you can even live with individuals who are in part of other scholars programs, not just the public health.
Yeah, they don't intentionally don't match up, all scholars from the same program with scholars to live together. That would be a little intense. It does happen, but they try to have
try to mix
across discipline matches for roommates. Let's see. So there's a question about the MCAT. So Dr. Lynn Arneson is the pre-med advisor. She has all of those stats at her fingertip, but I know that she says that 85% of our students that go on to take the MCAT are accepted to med school.
And I mean, afterwards, there's, I know that Dr. Arneson also teaches an MCAT course. So if a lot of you are interested in pre-med, that's something that you could consider further on after the program.
Is travel abroad usually fall semester the second year? Yes, it is. So all of the scholars select one of the 4 abroad options and spend the fall semester of the second year studying abroad. And many of the courses that you take while you're abroad are going to be counting towards your major.
As for Bridget's question, this is very unique to each student. I know students who have come in with 0 AP or IB credits, and then students who've come in with 20 credits. So it's really up to the individual, but either way, Dr. Malamasura, who's our advisor, she really makes it work for you. So it's not like if you come in with 0 credits, it's not that you're going to be behind or anything.
Yeah, our students,
so don't worry about that.
Students come in with no AP credits for a variety, of reasons, to 20 or 25 AP credits, I'd say. So either way, we just tailor the program to work with you. So we've got about 2 minutes. I'll take any other questions that you have, or you can email me. I'm going to thank you all for your time, and I look forward to getting to know you all better. And again, just anyone that's planning to come on the 17th, just if you could email me and let me know so I can make sure that you're paired with a current scholar.
Yeah, feel free to reach out through email, or I can give you guys my phone number. It's really up to you. I'm more than excited to meet you all. I hope to see you guys for the overnight stay. Thank you so much for listening to us, and thank you for your questions.
Thanks, everybody. Good night. Good night.
So then did you stop?
Good night, everybody.
Good night. I'm still here if anybody has any questions.
Yeah. You can see the screen.
Oh, thank goodness.
Because or else we would have to redo the